Hi guys, welcome to Module 6. It's hard to believe that we're almost done with our summer term already. So for Module 5, you guys submitted your articles, and for Module 6, you're going to be writing your research paper. So the topic is going to be, like I said in the directions, you're going to find an area that's of interest to you, and you selected 2 articles already for this. And you're going to be tying your paper in with nursing education, because nursing education is a huge part of our job and something that often gets overlooked or pushed to the back burner. But we know that if we give good education to our patients, that they have better outcomes and less return visits to the hospital. The problem is we have to figure out how to reach our patients. And, we have talked about patient, their knowledge and how important it is to find ways to reach them. We look at literacy, types of literacy, health literacy, information literacy. We have to pull all of that together. So your paper is going to cover whatever area of interest you have, but I want you to really bring in how you can teach that evidence-based practice to your patients in a way that's meaningful for them. How are you going to know that they understand that education that you've provided? So your paper needs to have a separate title page and a separate reference page. So we are using APA format. I strongly suggest looking at the OWL Purdue website that I have linked for you. So that just OWL stands for Online Writing Lab, and Purdue graciously offers that and is a great tool. Now, they have recently switched from APA 6th edition to 7th edition. Truthfully, if you give me a paper in either format, I'm going to be okay with that. Though, I think APA 7th edition is easier. It eliminates some of the running head and some of those a little bit trickier features when you are formatting. So it's a little bit more streamlined and easier to use. So you will likely want to use APA 7th edition. So I look forward to this, and you probably want to go ahead and get started on this early. So you already have your articles. If you would like to tie in additional articles, that's fine. I do have a couple words of caution. This is where students in the past have lost points. So remember, when you are writing a paper, that anything that is not your original thoughts needs to be cited, okay? So even if it's not a direct quote, most students realize if they're using a direct quote that they have to include an in-text citation. But even if you are paraphrasing the content, you still have to cite where did that information come from. It just doesn't have to be a direct quote. So please make sure that you are citing all content that is not your own, okay? And also, anything that's cited within the paper needs to also show up on your reference page, and vice versa. If you are citing a reference on your reference page, where did you use it in the paper? So it should be in both places. Your discussion this week is looking at the electronic health record, electronic medical record, and personal health record, and what are the similarities and differences, and also pulling in the concept of interoperability. So interoperability is a huge issue with informatics, and that means that one system doesn't necessarily talk to another system. So think about where that might have been an issue. I know even when you're using a single system like Epic, sometimes the nurses on the floor can't see the charting that's in the operating room or the emergency department because they're different, especially if you have patients going from one facility to another facility that use different health records. That can all play in. So I look forward to your posts. And we are coming into these last couple of weeks, so let's finish strong. Thanks.